small, normal, and you can study. Okay? So these are prefixes for size. For degree, hyper, hypo, oligo. Hyper means too much. Hypo means less than normal. Oligo means few, scanty. Pan means covering everything, covering all. Okay? Example here, hypercalcemia, hyperglycemia, or opposite, hypoglycemia or hypocalcemia, for example. Shall I ask you a question here? Can you tell me the root, the prefix and the suffix here? What is the root? Because we are talking about calcium, the inorganic substance, isn't it? Calcium is, what is it? Calcium is? Hyper means increasing in the blood. Suppose you don't use the term, then you will have to write like this. There is increased calcium in the blood of this patient. If you write patient has hypercalcemia, everyone understands that. All the health professions, they understand that. Hypercalcemia. Okay, let us go on. Prefix for time and or position. Okay? Like you already know, pre means before, isn't it? And opposite of that, post means after or behind. Similarly, ante means before, or like for example antenatal, before birth. You know, a pregnant woman goes to the hospital for ANC checkup, isn't it? This is called as antenatal care. Antenatal means natal period, okay, means the before birth, before natal period. Prefixes for position. Dextro, sinistro, ecto, endo. Ecto, endo you must be knowing. Ecto, endo. Endoplasm or endothelium. You must have heard this term. Isn't it? Endo or endothelium means inside, the lining. Isn't it? Histological. Ecto means outside. Dextro means towards the right. Heart is usually in the center and slightly towards the left. Isn't it? Slightly. In the center and slightly towards the left. When you are auscultating in a patient and you don't hear heart sounds, always auscultate the other side. Okay? Because rare condition is there, and that condition is called as dextrocardia. Okay? So the patient is having the heart on the right side. Okay? And this is called as dextrocardia, location of the heart in the right side. But what is the prefix here? Dextro, which is the prefix for position. Okay? So similarly you can study this. The remaining is for your study. I cannot cover everything. You will be bored anyway, because I will be repeating the same thing over and over again. So prefixes for time and position, prefixes for that is for time basically, and this is for position. Now here you see a prefix, word root, suffix and the medical word and its meaning. We will take only one. We will take only one. Amastia. Amastia. Mas basically means breast. Okay? Organ. Suffix is ia, means a condition. Prefix is a, like we know a negative prefix, means absence. A means absence. So what is absent? A condition in which the breast is absent in this particular woman. Amastia, without a breast. Just one example. Let's jump. Okay, shall I go ahead?
Let's come to exam like this. Let's come to exam like this.
Like this? No. Why it will come like this? Now suffixes. Now suffix. What is the suffix?
The last part of
Yeah, a word part which is attached at the end. Okay, at the end. What does it indicate? What does it indicate? What did the prefixes indicated? They indicated location, time, isn't it? What did the root indicate? The body part. Similarly, the suffix usually indicate the procedure, condition, disorder or disease. Okay? Like ia, ism, etc. Like we had seen in pericardium, right? by adding a suffix to the end of a word root, we create a noun or adjective with a different meaning. Like we see, if we go back to the simple word learn, if we add er to it, we change the meaning. Isn't it? It becomes from learn, it becomes learner. So when we are adding suffixes to medical terms also, we are changing the meaning of the term. With prefix, usually, we are not changing the meaning. We are only trying to indicate the location of the organ, okay, or whether it is happening before or after, direction or color, things like that, position, time. But with suffix, the meaning is changed usually. Cardiomyopathy, disease of the heart muscle. When you add pathy, yeah, this pathy, this pathological condition, this disease is occurring in muscle, myo, cardi of the heart, cardiomyopathy. Okay, so we are giving an entirely new meaning, which means what? What do you understand? The heart muscle of this patient is diseased, right?
What is the root of the root? The next one.
This is the root. This is the another root.
Another root.
Yeah, two roots. Or because it is the same organ, you can say one root. Cardiomyo, one, because the heart muscle, it is the same.
What does it mean, like?
Myo means related to or pertaining to the muscle. Myo means muscle.
Of heart.
Here of heart. Only myo means muscle.
Come before heart.
Yes. Myocardium. Yes, yes. Myocardiopathy. It's not usually called like that. It is called myocardium. It is called myocardium also. But myocardium is a separate, benign, normal term. But when you want to say disease of the heart muscle, cardiomyopathy is the term that is used. And this is an example for inorganic substances like hormones or enzymes. Okay, you must be knowing that enzyme, basically when you read a word, you know that this is an enzyme. Why? Because ase is attached to it. You know this already. So this suffix ase, ase, or ose, ose, when you attach, the meaning of the word changes. One means an enzyme, another means the substance. Okay? Glucose to glyc, like if you add ose, it becomes glucose or glycose. Okay? Glycogenesis, like that. So that means a sugar. That means a sugar. But when you remove ose, and you add ase, it becomes an enzyme which acts on this sugar. It becomes opposite. An enzyme which acts on this particular substance. Like lipase, for example. Lipase, lip or lip, LIP, fat. Related to lipid or fat. If you add ase to it, it is a substance which is acting on and breaking down, degrading, metabolizing lipids. Okay? Maltase acts on maltose sugars. Proteinase will act on proteins, so on and so forth. Suffixes that mean condition of, like we have seen previously, ia, ism, osis, iasis, and y. Example, acidosis. Acidosis means increased acid level or decreased pH of the body fluids. For example, if you are talking about body fluids or the blood, okay? Acidosis is the condition. Acidosis. If you add osis to it, that means higher acidity or lower pH levels in our body. Phobia. Phobia means fear of something. Why? If you add Y, titani, sustained muscle contraction. Okay? Sustained muscle contraction, either because of stimulation or because of calcium problem. Alcoholism, impaired control of alcohol alcohol abuse or alcohol use, okay, alcoholism. So means condition of iaism, osis, iasis and y. Suffixes for medical specialties. I will jump to my specialty first. Physiology. Logy is the suffix, means study of. Study of what? The normal functioning. In case of us, the human body. Ian, physician, isn't it? Physician means a doctor. Physician. So Ian, so these are for medical specialties. Okay. Iatrics, like pediatrics. Who is a pediatrician? Mahir Amrad al-Atfal. Right? Am I right when I say this? For the children. Pediatrician is the person. Pediatrics is the field in which he is specialized. What? Orthopedics. Orthopedics. Where is that? Here. Orthopedics. Orthopedics or orthopedician is the person who specializes in musculoskeletal problems, diseases, conditions. Orthopedician. Right? Gynecologist, obstetrician, geriatrician, nutritionist, so on and so forth. These are suffixes for diagnosis. Okay? For diagnosis. Graph, instrument for recording, like a polygraph or an electrocardiograph. Okay? Electrocardiography is the procedure. Electrocardiogram is the paper that you take for recording for the heart, electrical activity of the heart. Meter, something you use for measuring. Audiometer, for example, used to find out your hearing capacity. Audiometer. Okay? Metry is measurement of. Scope, you know scope, telescope, isn't it? So scope is always an instrument used to see something, anything. Endoscope, to see the inside of an organ. Endoscope. Endo, inside. Add the prefix endo to scope. So endo, you know, means inside. Scope means to see inside an organ. Endoscopy.
Look, what's the difference between graph and graph?
Yeah, graph is instrument for recording data. Gram is the record of the data. And graphy is the procedure, is the act of doing it. Graphy. Okay, that's the difference. Instrument, the way you do it, okay, the procedure and the output, the result. Okay, just a difference here. Scope and scopy. Scope, instrument for viewing or examining. Scope. Endoscope is an instrument for viewing the inside of an organ. Scopy, like the same difference, graph and graphy. So, is the examination of using the scope, for example. Laparoscopy or endoscopy, for example. Endoscopy will be the procedure of doing the or using the endoscope. And laparoscopy is examination of the abdomen through the abdominal wall. Laparoscopic procedure. Laparoscopic removal of the appendix, for example. Or laparoscopic hysterectomy. Yani laparoscopic removal of the uterus of the female. Hysterectomy. Like that. Somebody wanted to ask a question? Yes?
Can we add suffix without?
Can we add?
Suffix
Without root? No? The root has to be there. The root has to be there. Without root, there is no word.
No, there's three.
I haven't come across any word where there are only prefix and suffix without the root. See, for a root to form, word to form or a term to form, root should be there. Root is the basic, isn't it?
There's no tree without root.
Yeah, there is no tree without root. Direct, yani you don't want trees and things. You want Manosalvar directly from heaven, huh? Adjective suffixes. Adjective suffixes are those suffixes which change the meaning of the word. We have seen that in the previous slide. Adjective suffixes and noun suffixes, like ER to learn, ER to learn, making learner. So adjective suffix, if you add it to, for example, cardi, if you add AC, cardiac, means of or related to the heart, cardiac problem, and there is some problem in the heart pertaining to or related to the heart. So AC, AL, AR, ARY, so on and so forth. Okay, ORY, OUS. If you add OUS to vein, it becomes venous. Vein is a structure, right? What of the vein? Something of the vein, related to the vein, or venous, pertaining to, related to the vein. Examples of suffixes, just like the example of prefix that we had seen: combining form, suffix, medical word, and meaning. Gastro means related to the stomach. Related to the stomach. The O here is the combining form, which we will come to later. Itis is a suffix, which means inflammation. So if you add itis to gastr, it becomes gastritis. Yes, infection or inflammation of the stomach, meaning inflammation. Medical word becomes gastritis. This is one, itis. Now if you add megaly or if you add oma to the same word, gas, if you add megaly, gastromegaly, enlargement of the stomach. If you add oma, gastroma, isn't it? So oma means tumor, and that means tumor of the stomach. Here enlargement of the stomach. Similarly, another example using hepat. Hepat is the liver. Now this is very simple. I need not spend time on this. Just kept it as an exercise for you guys. But I find that you are understanding very quickly, alhamdulillah. So I need not do this exercise. This exercise was, I just wanted to ask, okay, cardiology, what is the root, what is the suffix and prefix? But you know that, okay? So we will just go quickly. Okay? Again, example for you: pericarditis, leukocyte, hepatitis, and neuroplasty. I just wanted from your side as an exercise before we go to combining forms, whether you have really understood prefix, root, and suffix. Tell me the prefix, the root, and the suffix from here. But I'm sure you can do. All of you can do that. Okay? So let's go ahead. Let's go to the answers. Okay? Go. Yeah, go. Quickly. Pericarditis.
That's white
Go back. Yeah. Pericarditis, leukocyte means leuko means white. Cyte means cell. Leukocyte means white cell. Similarly, hepat means liver. Hepatitis means itis, inflammation. Hepatitis, so things like that. Neuroplasty. Neuro means nerve or nerves. Plasty means surgical repair. Okay. Neuroplasty means surgical repair of the nerve or the nerves. Rules for combining vowels. Now, coming to the combining forms. Like I have told you, a medical term may have two roots. More than one root, isn't it? So how do you combine it? Whenever a combination is to be done, you use either of two vowels. So here, I should know whether you know about the English alphabet and the division of the English alphabet into vowels and consonants. Vowels and consonants. You know this? Do you know that the English alphabets, they are divisible into 5 vowels and the remaining are consonants? You know that? Yeah. What are the vowels? Yeah. A, E, I, O, U. A, E, I, O, U. These are the vowels. And almost all the English words are having one or more vowels in them, except for only a few 3-letter words like sky. Sky is not having a vowel in it, but still it means something. But usually, by and large, for an English word to mean something, it has to have a vowel in it. Okay, one or more vowels in it. So you know that. When you know that, then we can go ahead. So out of the 5 vowels, O or I can be used as a combining vowel for the medical term. O or I.
Just O or I?
Yeah.
Not all the 5.
Not all the 5.
O or I.
Just O or I. Okay? Now let us take up the first rule. First rule of combining forms. What is the first rule? A combining vowel is used to join root to root, like cardiothoracic. Thoracic, there is O in between. So cardi is root, thoracic is root. So root to root combined with a vowel O. So the rule is a combining vowel is used to join root to root as well as root to any suffix beginning with a consonant.
Why we didn't use I?
We can use I also, but let's complete the rules, then we will understand this point. Okay? So, what is the first rule? You can use a vowel to connect root to root or root to any suffix. Suffix means comes later. But this suffix should begin with a consonant, not with a vowel. If it begins with a vowel, we will see. That is another rule. It has to be dropped, deleted. Okay? Example, electrocardiogram. Electrocardiogram. Isn't it? So root, electro, vowel O, cardi, root, which is the heart, O vowel, gram is the suffix. What is the gram? The record. Isn't it? The record. So this is root to root, root to root. This is O. Or root to suffix which doesn't begin with the same. Cardi ends in I. Gram begins with G. Now suppose it begins with an I, then the rule will be different. Okay? So the first rule, it says a combining vowel. What is a combining vowel? Either O or I. So a combining vowel can be used or will be used to join a root to root or root to suffix that doesn't begin with a consonant. Clear? Second one, a combining vowel is not used before a suffix that begins with a vowel. That is the second rule.
Yes.
Now, like I have told you, this begins with a consonant. G is a consonant, it's not a vowel.
Yes.
If it begins with, suppose I, here, if there is I, if instead of only grams, it is I gram.
What should we do?
So, you have to drop one. A combining vowel is not used. So, a combining vowel will not be used. Okay? Like for example, vas is a root.
Yes.
Ectomy
There is
is a suffix beginning with a vowel. When it is already beginning with a vowel, you don't need to put O there or I there. Okay? Ignore it. So it becomes vasectomy. Next one, if the root ends in a vowel, like cardi ends in a vowel, I, and the suffix begins with the same vowel, it, like I was telling you just now, with I, it is ending, the root is ending in a vowel, I, and the suffix is beginning with a vowel, I, same vowel, you drop it. You drop it. Root ending in I, no vowel here, suffix beginning with I, the final word you will get as carditis. Okay? Carditis. You don't need to put O here or I here because there are already two I's mawjood. So even you will delete one. Okay? Now next, usually a combining vowel is inserted. Where it is inserted? Between two roots, even when the second root begins with a vowel. Now this is the confusing part. But medicine is like that. You know? Yeah, this is opposite of that rule. Yeah, but look here. Usually a combining vowel is inserted between two roots even when the second root begins with a vowel. In the previous rule we said when the second root begins with a vowel, ignore it.
So why we
What about now?
I don't know why. that is medicine and that is medical terminology. Yeah.
Just interrupt it from the.
Yeah, but my explanation to that point is the vowel is different. The vowel is different. Like for example here, cardioesophageal. Now here the first root cardi is ending in vowel I, whereas the second root is beginning with a vowel. Lekin it's not I, it's not even O, it is E. Okay, so you can. You should. I'm sorry. Everything I'm dropping something from you. I hope I don't drop your phone. So, because the vowel is different, I think this rule is there. Because the vowel is different. So, when a root word is ending in a vowel, like here you can see it is ending in I, and the second root is beginning in a vowel, which is E. So here I, here E, so you can insert a combining form here and that will be O. Okay? Okay? Cardioesophageal. Because it looks odd, to say cardioesophageal. So cardioesophageal. A combining form is added when first root is ending in a vowel, second root is beginning with a vowel. But my additional explanation to that is because the vowel is different for the second root. Yeah.
I think it's the bit about the Bible. We can pass waste in the word. We can delete it. Like it's we pass waste.
Yes. More to do with the pronunciation. Yes. Pronunciation, like you are saying. It has more to do with the pronunciation rather than the writing of the word. Yes. Lastly, occasionally means rarely or sometimes, when a prefix ends in a vowel. Now we are talking about a prefix, not a root.
Yes, prefix.
Occasionally when a prefix ends in a vowel and the root begins with a vowel, this is the root. Okay? Enter is basically used for, English word is totally different. Forget about the English word enter. Enter on the keyboard or enter. Here enter in medical terminology means the intestines. Okay? Gastroenteritis, isn't it?
Yes.
Or enteric fever, which is typhoid. Enteric fever. So enter is the medical term for intestines. Okay? So please remember that. So enter, obviously here is the root word. Enter means intestine. Okay? This is root. Intestines. Intestines, after the stomach there is the duodenum, then the intestine, the large intestine, small intestine. Enteritis, enteric fever, so on and so forth. So you will be coming across so many times, enter. But we were talking about the rule. The rule is occasionally when a prefix like this here example ends in a vowel like para. Okay? Para. Basically para is used to mean, what is the prefix? Para? Parallel to, isn't it? Para, parallel to, short prefix for parallel to or alongside. Okay? Pertaining to alongside of the intestine, parenteral. So what is the rule? When a prefix ends in a vowel like A, it is ending in a vowel, and the root begins with a vowel, enter E, it is beginning with a vowel. The final vowel, that means this is the final vowel, is dropped from the prefix. What is the final vowel from the prefix? A. This is the final vowel. Final means last. You can say last vowel instead of final. Okay? The last vowel from the prefix is deleted. You need not say parenteral. Okay? If you just drop A, it becomes parenteral. Parenteral means pertaining to or alongside of the intestine. Okay? So these are the rules of the combining forms. Combining forms. They are consisting of the word root and a connecting vowel O or I to make it easier to pronounce and attach another root word or suffix. So what is the combining form?
Like adding or
Yeah, combining form is basically the usage or addition of the vowel O or I to root.
Yeah.
Okay, to root or suffix. Why? To make it easier to pronounce and to make it easier to understand. Okay, like you were saying about the pronunciation. So that's a combining form. Combining form for hard here, like the simplest word which we are using from the beginning, cardiology. So on the one hand there is the heart, the body organ, body part. Another is the suffix logy, is the study of. Now if you want to combine these two, you have to use a combining form, a combining vowel, either O or I. Here, because of the logy, you use O, which becomes cardiology. So O is the combining form. So this term, cardiology, medically speaking or medically terminologically speaking, it is consisting of three parts: root, a combining form, and a suffix. Understood, everyone?
Yes.
Combining form associated with cells, like cyte is the root word, logy is the study O. Cytology, histology, microbiology, pharmacology, so on and so forth. Okay. Glycoproteins, these are combining forms for substances. Okay. Glyc, protein, two root words. O is the combining form. Glycoproteins, proteins conjugated with, combined with sugars. Lipoprotein, protein combined with, conjugated with, added with lipids. Okay?
Yes.
Again, this is the explanation of the same thing. You can read this at home. Okay? No problem? See here, hyperlipoproteinemia, a big word. Hyperlipoproteinemia. Here there is a prefix, there is a root, there is a vowel combining form, there is another root, and there is a suffix.
Why we
Okay?
why we add word to the root and suffix?
Why?
Why we add
Here?
no protein and you?
Here.
Yes.
What we should add? Because the suffix is beginning with a vowel. Because the suffix is beginning with a vowel. Okay? When it is already beginning with a vowel, most of the time we don't need to add, we delete that vowel. We drop that vowel.
What if the suffix, first letter of the suffix was not a vowel? We should
Then we add it. Like logy, for example. Logy begins with a consonant. That is the first rule. What is the first rule? When the suffix begins with a consonant,
We should delete that.
we should add a combining form. Isn't it? You know this thing, jigsaw puzzle? A puzzle. What is